My name is Dr. Kaufman. I'm the Chief of Breast Surgery at St. Joseph Hospital. I'm the Director of the Breast Cancer Program here and the Director of the Breast Health Center. And what I'd like to talk to you about today is how 30s are the new 40s and how early detection can save your life from breast cancer. In addition, I want to talk about breast cancer around the United States and on Long Island. But first, I want to talk about some myths. And I added this in because this is a very important topic. A lot of women have misconceptions about breast cancer and how it shows up and how we treat it and how we cure it. So I put together some myths, and I'd like to just roll through these quickly. Breast cancer, myth number one, breast cancer always appears in the form of a lump or with pain. Not true. Many women think that if they have pain in the breast, it's a sign of cancer. Not true. It's extremely rare for breast cancer to cause breast pain. There are cases, but it's extremely rare. And if you are having breast pain, it's a good idea to get it checked out. But in general, you should rest easy that it's probably not cancer. Also important to note that if somebody has a lump in the breast, oftentimes a woman will think that they have breast cancer. Not true. In fact, 80 to 85% of lumps in the breast are benign and not cancerous. Nevertheless, if you have a lump in your breast, an expert needs to check that out. Don't take it for granted because 85% of breast lumps are not breast cancer, that it's not going to be anything bad. You still need to get it checked out. Second myth, eating organic foods will reduce the risk of breast cancer. While organic foods are not exposed to chemical-based pesticides, fertilizers, or genetically modified foods, the jury is still out regarding the benefits of eating these foods in terms of reducing the risk of breast cancer. Proven ways, however, to lower the risk of breast cancer are to eat a healthy, well-balanced diet, low in fatty foods, low and fast foods, and processed foods. Eat plenty of fresh fruits and veggies, fresh foods and whole grains, and stay well hydrated. Drink a lot of water. Most Americans don't drink enough water. First thing I do in the morning when I get up is I drink a full glass of water with lemon and lime in it. And that's how I start my day. And that helps cleanse the system. Healthy eating habits also help maintain good body weight, which is important since being overweight or obese is one of the risk factors for breast cancer and so many other diseases. Healthy lifestyle choices are also important, like smoking and consuming large amounts of alcohol, both known to increase the risk of breast cancer. Myth number three, women don't need to have an annual mammogram. Not true. Women do need to have an annual mammogram, despite what you see in the media. Women should start having a mammogram at age 40 and then every year thereafter. Many women think they can skip a year and have it every other year. I can't tell you how many cases of breast cancer I've seen where a woman skips 1 year and then they get it the next year and boom, there's the breast cancer that would have been picked up had they only had their mammogram the year before. Some women actually need to have mammograms before age 40, and we'll talk about that as we go through this talk. Myth number four, if I have a breast MRI, I don't need a mammogram. Many women ask me, if I have an MRI or an ultrasound, why do I still need a mammogram? One does not replace the other. These tests work in harmony. They all work together. Breast mammogram, breast MRI, breast ultrasound. All of them work together to help us diagnose breast cancer early. So we oftentimes need all three modalities. And in addition, breast examinations, very important, which I'll talk about. Myth number five, my father's genetics have nothing to do with my risk of breast cancer. I've seen this and heard this many times. Women think that they can only get breast cancer if their mother had it or their grandmother had it. No, not true. If breast cancer occurs in men in your family, you're equally likely to inherit the bad genetics from your father. That's why it's important to know not only your mother's history, but also your father's. It's equally important to know that if there's breast cancer on your father's side, that he also gets tested for genetics, and we'll talk about that as well. Remember, you get half of your genes from your mother and half from your father. Next myth, having a mastectomy removes all chances of getting breast cancer. Not true. Yes, mastectomy is our best tool. It reduces the risk of getting breast cancer, 90 to 95%, but it does not remove it 100%. For women who have a preventative mastectomy, women who have their breasts removed to prevent breast cancer, they do get 90 to 95% protection. It's the best tool we have. Women who already have breast cancer, it gives them a 90 to 95% protection against getting it again, but not 100. There is no tool that prevents this 100% of the time. The next myth is a breast cancer diagnosis is a death sentence. Oh my God, I have breast cancer. Am I going to die? Not true. The fact is, if you get breast cancer and we find it at an early stage, there's well over a 90% chance of survival. Over 90%. That's unbelievable, and I'll talk about that more. Even breast cancer that's caught a little bit later, there's still a very high chance of long-term survival, over 70 and 80%. The bottom line is, if we catch it early, you have a great chance of living a normal, healthy life, which is why early detection is so important, which is why you're examining your breasts, you're getting your breasts examined, you're getting your mammogram every year. Very important. And lastly, needle biopsies or poking at the breast can spread breast cancer. Some people think that if you touch it or poke it or hit it with a needle, it's going to spread the breast cancer. Not true. Multiple studies have proved that if you put a needle in a breast cancer to get a diagnosis, or if you operate on breast cancer, it's going to spread. Multiple studies have shown that that's not the case. Needle biopsies and surgical biopsies of breast cancer, it's all very, very safe. Does not increase the risk of breast cancer. A little bit about what's going on legislatively to help protect us. In 2019, Governor Cuomo signed Shannon's law. This requires large consumer group insurers to cover mammograms. This was a landmark law, and I thank the governor for making Shannon's law ever present in our lives. Who was Shannon? She was a young woman in her 30s who lived on Long Island, who got breast cancer in a very young age, and she was not able to have a mammogram because her insurance company wouldn't approve it and wouldn't pay for it. This law is named after her. And here is the law, and that's the name of the number of the law, and it covers medically necessary mammograms for women aged 35 to 39. And many insurance companies were only required to cover it over age 40. But it's important to understand 12,000 cases of breast cancer are detected annually in the United States in women under the age of 40. And these cancers are often more aggressive, which is why this law was so important. And several of our local legislators supported it, including Monica Martinez and Kimberly Jean-Pierre. So some facts and figures about young women with breast cancer. And I hope some young women get to see this webinar and get to take this seriously. Breast cancer in young women is, of course, rare. It's rare, but it does happen. More than 250,000 women in the United States right now were diagnosed under the age of 40. In young women, breast cancer tends to be diagnosed in later stages, not early on. And they tend to have a more highly aggressive type of disease, and the mortality or the death rate is higher, which is why young women, it's important for you to be involved. There's no effective breast cancer screening tool for women under age 40. Mammogram does a good job, but it's not the best tool because of dense breasts, which we'll talk about. And here, this graph shows that. If you look along the left-hand side, it says survival by percentage. If you look along the bottom, it says age of diagnosis, how old you are when you get your breast cancer. And you can see the graph. If you're over 45 years of age, the survival rate is in the 80s, sometimes in the high 80s. That's amazing. But look at the group, the young group, 25, 30, 35, 40. The survival is much lower. And that's because the disease is found later and tends to be more aggressive in this group. But breast cancer is still the most common cancer in that age group, under the age of 39. It's amazing, the most common cancer in young women. In 2019, and these are the latest statistics, the 2020 statistics are not out yet, In 2019, the American Cancer Society projected that there would be about 270,000 cases of invasive breast cancer in US women and 48,000 additional cases of in situ breast cancer. This is the kind that does not spread. Invasive cancer is the kind that does or can. 13,000 of these cases are going to be under the age of 40, and 45,000 women will under the age of 45. So this is a tremendous number. 45,000 women under age 45. And 1,000 women every year under age 40 die of this. These are staggering numbers. And 80% of young women diagnosed with breast cancer, they often find the cancer themselves by just touching their breasts and feeling a lump. That's how important this is. And that's how easy it is. Just examine yourself. If you don't know how to examine yourself, you can Google how to examine the breasts, or you can go on my website at breastcarespecialist.com. And there's a page there that's dedicated to teaching you how to examine your breasts. Or you can come in and we'll teach you how to do it. There's a lot of ways to learn how to examine your breasts. Breast cancer is the most common form of cancer in women who are pregnant or recently given birth. That's an amazing number. Women who are pregnant or just given birth. Only 30% of breast cancer is within a few years of women who just had a baby. Ladies, you got to be careful when you're young. And remember, these are more aggressive cancers and there's a lower survival rate. It's really important to find this early. And African American young women have a disproportionately higher rate of high risk or very aggressive breast cancer. They have a higher risk that it spreads, they have a lower survival rate, and we don't understand why. But their breast cancers are more aggressive and in higher numbers. In addition, Latina women and non-Hispanic, Native American or Asian women have a higher rate of breast cancer, and we don't know why. So what are the risk factors for breast cancer? What do we know? Well, we do know that having a personal history of breast cancer or ovarian cancer increases your risk of getting another breast cancer. We know that having a family history of breast cancer is a very important risk, and in fact, the #1 risk other than having the disease yourself. If you have family with breast cancer, you need to pay attention. If you have a previous breast biopsy, if you have a lump and they had a biopsy and it shows atypical hyperplasia or carcinoma in situ, those are precancers in many cases, and that increases a woman's risk of getting a cancer. In addition, having your first menstrual period before the age of 12, or having your menopause after the age of 55, what that means is the more years you have your menstrual cycle, actually the higher the risk of having breast cancer. It has to do with the amount of estrogen or female hormone in your blood. In addition, women who've never had children have a slightly higher risk. Women who have their first child after the age of 30 have a slightly higher risk. Having a genetic mutation in the BRCA gene or 9 other breast cancer related genes, at least 9 that I'll talk about. Drinking a lot of alcohol. Some alcohol is good. Red wine is good, but excessive alcohol is not good. 3 or 4 drinks a day, not good, may increase the risk of breast cancer. Being overweight, especially after menopause. Ladies, if you're over 50 or 55 and you're in menopause and you're overweight or gaining weight in that age group, this is not good. It increases the risk of breast cancer. So here at St. Joseph Hospital, we have a cancer center, our brand new cancer center and our brand new breast health center. And what do? We engage people, we get them into the system to get early diagnosis and treatment so we can increase survival and improve care. How does that work? Well, it starts with screening. The first thing we need to do is get people screened. And how do we screen? They get referred, they see a video like this, and they get a call to action, and they get involved, they go get a mammogram, and they come see somebody like me to get evaluated. Or on the internet, they read about it. And they have family and friends who encourage them or have had a problem. Or they say, go get your mammogram, especially by age 40. And of course, primary care physicians and OBGYNs, they refer patients in to get screened. And the social media, it's all over social media. So people get in, they get screened, they fall into this basket, we find out if there's a problem, and the next thing we do is diagnostic. Woman has a lump in the breast or an abnormality on the mammogram, and then what do? We might do a mammogram, we might add an ultrasound or a breast MRI, we might do a needle biopsy, we might tell the woman they have to examine themselves more often, or do more clinical examinations, meaning go see your doctor more often. Maybe the lump is nothing, but we need to watch you. And then if we find a problem, they go through into this basket, which is treatment. And treatment comes in many forms, from medicines and surgeries and close observation and reconstruction and radiation. So that's how we handle the entire continuum of care, from getting people into the system to getting them treated and getting them healthy. And we do that here at our brand new Breast Health Center at St. Joseph Hospital. And just a reminder, yes, October is Breast Cancer Awareness Month, and this is all over the place. You see pink everywhere, every TV show, every newspaper, magazine, and ad is all about Breast Cancer Awareness Month. That's true. But at the Breast Health Center, I believe, and we believe, that every month, all 12 months, are Breast Cancer Awareness Months. This doesn't go away in November. Some history. In 2005, this was the cover of US News and World Report. It said, "Are we finally beating breast cancer?" 15 years ago. New breakthroughs offer women more hope than ever before. Was it right? It was, and I'll show you why. What's important to recognize, this disease affects women of all colors, creeds, and age groups, all religions from all over the world. I've shown you some statistics already. In the United States, 1 in 8 women will be diagnosed. That's about 13% of the population in women who live to at least age 85. Staggering numbers. Ladies, we need to be careful with this. This is not a death sentence if you just go out and get checked. Again, I said before in one of the myths, 85% of breast lumps are not cancer. So if you get a breast lump, don't panic. I can't tell you how many women I see in my clinic, in my office, or in the breast center that have a lump, and it turns out to be nothing bad. So some more history. In 2006, just look at the numbers. In 2006, right after that article came out, 215,000 new cases of invasive, that's the dangerous kind, invasive breast cancer. An additional 55,000 cases of in situ breast cancer, that's the non-invasive kind, the non-dangerous kind. In that year, 41,000 women died. And men, gentlemen, men get breast cancer. And I'll show you what's happening with that statistic. Fast forward to 2013, the number increased by about 15,000. More cases of invasive breast cancer, more cases of in situ breast cancer. 40,000 women died. The number went down. In 2006, it was 41,000. In 2013, it was less women. We're making progress. The disease is increasing. Less and less women are dying. This is amazing. And men, gentlemen, 2,240 cases in 2013 of male breast cancer. Why? We can talk about that. But worldwide, 450,000 cases of breast cancer that year. Fast forward to 2019, women, 268,000 cases. Again, the number going up. But look at this. 48,000 cases of in situ. The number's gone down. Less in situ cancers. Women are taking better care of themselves. They're finding things earlier. They're helping prevent breast cancer. About the same number of deaths, but the number is not increasing, even though the number of cancers is increasing. The death rate is not increasing. Men, increasing numbers of breast cancer, gentlemen. 480 deaths in 2019 out of the 2,670 men with breast cancer. And look at this number, 2 million cases of breast cancer worldwide. Remember I told you there were 450,000? Now over 2 million. So the disease is increasing. But what it's important to remember, only 27% decrease in breast cancer deaths over the past 25 years. 27% is an amazing number. 27% less women dying of breast cancer worldwide than just 15 or 20 years ago. Amazing. I know this is an incredibly difficult slide to read. I didn't put it up there for anybody to read, except for me to show you something. This is estimated cancer cases by state in 2005. If you look down here to New York, right here, in New York in 2005, 15 years ago, where we are right here, 14,400 cases of breast cancer. California was always the highest state in the union, 21,000 cases. Now you fast forward to 2018. 2018, New York down here, 17,000 cases, many more. But look what happened to California, 29,000 cases. So the numbers are increasing there as well. But what's really interesting about this, and the reason I put it up, is because of all the snowbirds. Look what's happening in Florida. In Florida, almost 20,000 cases. Number of years back, there were only a few cases in Florida. So the population is changing, the demographics are changing, the population is aging, and you're starting to see increases cases of breast cancer in places where they never really were. Texas is another place where the number of cases is increasing. Many people migrating to Texas. So you might ask, what about Long Island? What happens here? So I broke this down by county, Nassau and Suffolk. And this is really interesting. And these are the latest data that I could find, and it dates back to 2015. It takes time for these data to catch up, but in 2015, and data to be published. So right now in 2015, which is the best we have, if you look at the female breast cancer cases in Suffolk County, there were 1,300 cases. In Nassau County, there were 1,295. Less cases in Nassau, more cases in Suffolk. I find that fascinating. If you look back 20 years ago, there were so many fewer cases in Suffolk than in Nassau. The reason? More and more people living in Suffolk. The population is exploding in Suffolk County. More cases, more cancer, more people. So why? Why are we getting all this breast cancer? Why? Well, we don't really know. But I'm going to go over this slide, which may answer some of those questions. Well, there's improved detection. There's awareness, more people in the program. There's the aging population. We're getting older. Cancer occurs many more times in older people. There's the growing and changing population. The demographic is changing. And this is a changing disease. It's changing right before our eyes, and I showed you some of that. But what about the risks? Hormones, birth control pills, replacement hormones after menopause, toxins in our environment. I'll show you about that. Dense breast tissue, which I'll talk about. People who are obese, diet and lifestyle, smoking, excess alcohol, delayed or no pregnancies, and stress. Stress implicated in so many cancers. Then there's unknown factors, things we just don't understand, and genetics. And I'm going to talk about a few of these. And then so awareness. What happened in 2013? Angelina Jolie decided that she was going to have a double mastectomy after testing positive for the BRCA gene. The BRCA gene was discovered in 1994, and that increases a woman's risk significantly if you have that. Risk for breast and ovarian cancer, cancer of the ovaries. So in 2013, she had a double mastectomy, and in 2014, she had her ovaries removed to help prevent against breast and ovarian cancer. She's not alone, though, but she had a nipple-saving mastectomy, and she reduced her risk out of fear of getting the disease. So the demand for this is increasing because of people like Angelina bringing it to the forefront. And the media. And I call that the Angelina effect. But there are others. Juliana Rancic, age 38, Christina Applegate, age 41, Sharon Osbourne, age 60, all double mastectomies because of risk. So this affects everybody, all ages, creeds, colors, religions. origins, and men. So again, toxins. Are there chemicals in our drinking water? What about the toxic plume in the groundwater, the Grumman contamination that they're working to clean up right now? There's a 2 by 4 mile long plume in our groundwater right under us, which may contain chemicals like 1,4-dioxane, trichloroethylene, and perchloroethylene. These are just scary just to say the names. Look at your food labels. A lot of junk in the food. So this stuff might be in our groundwater causing breast cancer. We don't know. And then we're dumping detergents and soaps and personal care products into the ground as well. And cesspools, no longer in Nassau, but still in Suffolk, are cesspools leaking into the groundwater. So what's the treatment? Drink purified bottled water. At least that's the best hedge against this. And I'm not a big advocate of that. Sometimes I'm not sure I really believe it's any different, but that's all we have right now. And then there's dense breasts. What about it? Dense breast is a common risk factor for breast cancer. Why? So a lot of women have dense breasts. What is dense breast? Well, look at these mammograms. This is a fatty breast, probably an older woman. Already all the breast tissue is gone. As a woman gets older, the breast gets less glandular, less dense, and more fatty. One of the reasons, ladies, why the breasts start to sag as you get a little bit older. Less thick, less firm. And then in B, you can see a little bit of breast tissue still remaining behind. And in C, a lot more breast tissue or gland. This is where the milk is made. And then in D, there's a lot of gland. This is a whiteout, what we call a whiteout mammography, where the whole breast is replaced by gland. This is probably a very young woman. The problem here is that women who have this type of a mammogram, the cancers hide in there. You can't see through this. You can't tell what's there. Secondly, dense breast tissue is thought to harbor more breast cancers because dense breast tissue is thought to be immature, and immature breast tissue is more susceptible to toxins and chemicals, therefore increasing the risk of breast cancer. But what's good about this is now 36 or so states in pink now have some sort of breast cancer, breast density notification system. So if a woman has dense breasts, they need to be notified. And the important part of that is that if they have dense breasts, they can do something about it, like closer observation, increased self-examinations and doctor examinations, have a 3D or advanced mammogram, which is 40% more accurate. Have an ultrasound, have a whole breast ultrasound, which is automated, very high tech. Have a breast MRI or an enhanced mammography where we give contrast, or a molecular breast image, which is done at Mercy Hospital, or a PET scan, or positron emergence mammography. All of these tests help diagnose breast cancer in women who have very dense breasts. And then there's genetics. What about breast cancer and ovarian cancer syndrome? So there are a lot of genes now. In 1994, BRCA1, BRCA2, but now there are at least 9 other genes, and probably more, that we've identified that increase the risk for a woman to get breast cancer and other cancers. So if you're at increased risk, we're going to do a simple blood test and find out if you have any of these genetics. And we can help prevent breast cancer by knowing this information, help preventing you from ever getting it. And this is all over the news. You see it on the news. You see it on TV shows and commercials. 23andMe, Ancestry.com, etc. But we can do advanced testing, not 23andMe, not Ancestry.com. We're talking about focused testing to look for breast and ovarian cancer risk with these types of genes, which we do now. Yes, there are a lot of genes we still don't understand. And women come to me all the time and they say, I have breast cancer and I tested negative. How could that happen? Because there's so much we still don't know about all the causes of breast cancer. So what is the breast? The breast is a gland. The gland makes milk, and the milk is for nursing. It's made up of glandular tissue, fatty tissue, and ducts. Ducts are the plumbing that carries the milk to the nipple for nursing. And where does breast cancer begin? Breast cancer begins right here in the milk ducts. And as the cells increase, they start to change. You get more and more cells. Here's an open milk duct. Here's a duct that's starting to close down because the abnormal cells are growing inside. And here the duct is completely closed off, and here it's become cancer, and now the cancer is shedding or spreading. But still, if you detect it early, there's a much better chance of eradication and long-term survival. Can it be prevented? It can, with self-examination. Remember, ladies, make sure you're examining your breasts every month between periods. So 10 to 15 days after your period is the optimal time. If you get your menstrual period on October 1st, October 10th to the 15th is the optimal time to check yourself. If you no longer menstruate, the 1st of the month or the 15th of the month, you pick the day. That's the best time, but every month. And you're looking for change. You're looking for lumps. You're looking for skin changes, dimpling of the nipple, blood coming out of the nipple, all of those warning signs. You find any of that, go to your doctor. You don't know how to do a self-exam? breastcarespecialist.com has a page dedicated to this. Or you can Google it, or ask your doctor to teach you how to do it, or ask us to teach you. Make sure you go get your breast exam yearly. Go to your doctor and get your breast examination at least yearly. If you're high risk, more than yearly, every 6 months, or even more frequently. And this is not the way to have your breast examined with multiple people in the room. We don't want to do it that way. We want to do it in a private, comfortable setting. And then there's 3D mammograms or tomosynthesis. The American Cancer Society said, get your first one between age 40 to 45, and then between 45 and 55, get it every other year after 55. No, this is wrong. I don't agree. The experts don't agree. We don't do mammograms every other year. Starting at age 40, every year, that's the best way to find it early. The American Cancer Society also said, if you can believe it, don't examine yourself and don't go for routine clinical examination. I'm a big advocate of the American Cancer Society, but the experts don't agree with them. So do your self-exam monthly and make sure your breasts are checked annually. And here's an example of a 3D or very advanced tomosynthesis mammogram. Traditional mammogram looks at the breast from the top down and from the side. 3D mammography looks at this like a paperback book. You ever take a book and flip through the pages? That's what a 3D mammogram does. And you can see that in the lower portion of the screen. Multiple slices through the breast tissue. And that helps us to see inside the breast much better. But if women controlled medicine, they would do this to men, and they would call it the manogram. I put this in there because it's kind of funny, but most women blame me for mammographies hurting. Well, ladies, just a piece of information. A man did not invent mammography. A woman did, just to let you know. Keep the record straight. So don't blame us because it hurts. But I will tell you, a mammogram that's a little uncomfortable is a great mammogram. That means the technician is getting a great picture of your breasts. So if it hurts, I get it, it's uncomfortable, but it means it's a good study. And then there's breast ultrasound. And look at these images down here, bottom. Look at this. This is a 3D ultrasound. Look at the tumor in the breast right here that you couldn't ever see. And this is whole breast ultrasound. All of these very far advanced technologies. Look at this. We have handheld ultrasound now, where you can see the images on your iPhone or your smartphone. It's amazing what we have. Look at these ultrasound images. This is the type of stuff that you would never see in a dense-breasted woman, but it shows up in an ultrasound. Ladies, if you have dense breasts, make sure you get an ultrasound. Or a breast MRI. Breast MRI is even more advanced, and we can see things on MRI that we can't see on mammogram or ultrasound. That's why all of these tests work together. And you can see there's a cancer in the breast right over here, this white spot, or here, only seen on a breast MRI. And then we have so many minimally invasive advanced techniques. Minimally invasive, that's one thing that I'm expert in, where we can now do biopsies and remove tumors without surgery. Surgery is no longer. We now use various types of needles to do biopsies and remove tumors. I've removed thousands, literally, of tumors without surgery and avoiding the old-fashioned surgery where you have an open cut and you have healing issues and pain, increased cost, time away from your family and from work. We don't need to do that in many cases anymore. And we do biopsies in many different scenarios. Here it is under ultrasound. Here's the tumor in purple, and here's the needle going in through the skin, a little local anesthesia through a tiny incision. This whole tumor, in many cases, can be removed with that tiny needle. And we have all different types of biopsy devices. This just happens to be the device that I use. And we can do it in various ways. And I just want to show you quickly how this works. The needle goes in. Here's the needle. Here's the tumor in pink. Here's the needle in gray. We put the tumor into the breast right by the tumor, and it actually has suction, and it sucks the tumor down into the needle. And gently, it cuts off pieces, and the section of the tumor actually gets withdrawn through the back of the needle. And you can see we take bites out of it, and slowly over time, the tumor gets smaller and smaller and smaller until it's completely gone, or a good section of it is removed, so we can at least figure out what it is. As opposed to open, invasive surgical biopsies, where you have to go to the operating room and have general anesthesia. There might be scarring or disfiguring cuts or stitches, pain, costly, increased recovery time. We don't do a lot of this anymore, this open type of surgery to determine what's wrong in the breast. Yes, we still do surgery to remove cancers, of course, but to find out what they are, that's really old-fashioned, and we don't do it very much anymore. Ladies, you should not be having surgery in most cases to diagnose a lump in the breast. If your surgeon or somebody wants to take you to surgery to do a diagnosis test and cut your breast open, I don't agree with that in most cases. And what about preventing breast cancer? Can we prevent it? Yes, we can, by using certain drugs like tamoxifen or Evista. What does that do? It blocks the female hormone, estrogen, and helps prevent breast cancer. We can remove the breast, which we talked about before, lowering the risk about 95%. And here's some examples, ladies, of what we do here at St. Joseph in our breast program. Young women, breast cancers. Believe it or not, the woman on your left has actually had a double mastectomy. This is a nipple-sparing or nipple-saving mastectomy. Both of her breasts were removed. We saved her nipples, and we rebuilt and reconstructed her breasts. Amazing. I think everybody would agree this is an amazing result. On the right, there's a woman who had breast cancer in the right breast, and she opted to have a double mastectomy as well. Unfortunately, her cancer was located right at the nipple on the right side, so we were unable to save her nipple. However, we were able to save her nipple in the opposite side. So she had a double mastectomy. The cancer involved the nipple, but she will have nipple reconstruction, and everybody would agree this is also an amazing result. And here are some other women. Here's another woman who had nipple-sparing mastectomy, side views, frontal view. Here is preoperatively before surgery. Here she is postoperatively. This is an amazing result. Through tiny incisions right around the nipple, we removed both of her breasts, saved her nipples, and saved her breasts. And everybody would agree that these results are amazing. So breast cancer is not a disaster anymore like it was 10, 20, 30, and 50 years ago. We don't do those big disfiguring operations anymore in most cases. What else do we do here? Far advanced things like sentinel node biopsy. And here's a sentinel lymph node. Here's to orient you. The patient's head is up here, the breast is over here, the arm is over here, and here's her lymph node in blue. When we do breast cancer surgery, we have to remove some lymph nodes. 10, 15, 20, 30 years ago, we removed all of the lymph nodes. We don't do that anymore. It's a surgery that has a lot of complications and side effects. We only remove what's called the sentinel nodes, and we get the same amount of information. Very high tech, very far advanced, done right here at St. Joseph Hospital. So in almost coming to the end here, there are some exciting things happening here in our breast program, and the same thing at Mercy. We have our breast health center. We're doing oncoplastic reconstruction. I showed you some examples of that. What that means is we take out the cancer and we combine that with plastic surgery. Onco is the cancer surgery, plastic is the plastic surgery. We combine the two and we create an amazing result. So your breasts look great after surgery, maybe even better than before we started. We do something called hidden scar surgery. We hide the scars, and I showed you some examples where you don't even really see them. We save all of your skin and we save your nipples many times, even if you have to have a mastectomy. We have implants that we put in now that are biodegradable. Over about 2 years, they dissolve. And once they're gone, the breast hopefully will heal in a beautiful fashion. We do a lot of genetic testing. We do a lot of prevention of breast cancer. We do a lot of lymphedema diagnosis and prevention. That's swelling of the arm after breast cancer surgery. We now have technology to help prevent it and diagnose it early when it's treatable and reversible. We have targeted and tailored chemotherapies if you need chemo. We have our brand new infusion center where we can give medication that's specific for your cancer. Years ago, everybody got the same treatment. Not so anymore. We now understand the cancer, so we can give medication that goes just to your particular cancer, so it's treated specifically. We do a lot of high-risk screening. We have a lot of high-risk patients. We have all the state-of-the-art imaging, mammogram, sonogram, MRI, etc., and the minimally invasive biopsies I showed you, and many more things. So you're not alone at the breast center, and if you need something, we're here for you. Remember, October, Breast Cancer Awareness Month, but all 12 months are Breast Cancer Awareness Months.